Okay. Hi, everyone. My name is Chris Shea, and I will be introducing my team in their arguments to this debate over neurodiversity affirming practices. Today, we have Josh and Laura Ellen, who will be our attackers. And following them, we have Gabby and her partner Katrina as the stator approvers. To begin, I will inform you what neurodiversity is. Neurodiversity is the concept of neurological differences, including various brain functions and behavioral traits that are normal variations in human development, than deficits or disorders. The term neurotypical describes individuals whose neurological development and state are consistent with what is considered typical in society, while neurodivergent refers to those whose neurological patterns differ from societal terms or societal norms. Some topics our friends have decided to discuss during this debate are sensory based interventions that also focus on interdependence and not normative social behaviors. It's also known as the SBI. Strategies that you can use as a sensory stimulation to improve behavioral outcomes. SBIs are based on the idea that sensory processing differences in autistic children can impact development across various areas. These interventions aim to change how children process sensory information, leading to improvements in skills and behaviors like attention and self regulation. They're also focused on interdependence and not behaviors represent a shift in approach within fields like autism, intervention, and special education. One of our second topics is the ethical dilemma of typical appearance as a goal. The ethical dilemma of typical appearance in neurodiversity and specifically within autism interventions revolves around the tension between promoting an individual's well being and anatomy versus conforming to societal expectations of normalcy. The tension between anatomy and acceptance and social integration and functioning represents the core conflict. The last topic that we came up with was, should different functioning and severity levels be viewed differently? This question represents an ongoing debate, like what we'll be showing you today. It'll particularly show us in the context of autism, and those against differentiation argue that categorizing individuals based on perceived functioning is harmful since it can lead to lower expectations, stigma, discrimination, and internalized ableism. They also emphasize that autism is a spectrum, and also individuals deserve respect, dignity, and equal opportunities, regardless of their support's needs. They believe focusing on deficits rather than strengths undermines autonomy and well being. On the other hand, those in favor of differentiation argue that recognizing varying support needs is crucial for proving appropriate individualized services. Ignoring differences can result in inadequate support for those with higher needs and one size fits all approach that isn't effective. They believe that acknowledging differences allows for tailored interventions and resource allocation. Next, I will discuss some of the ethics codes that are important to our debate and also why ethics codes are important overall. Ethics codes are important because not only does it provide a consistent framework for making decisions, but it ensures that all team members have a clear understanding of acceptable behavior and practices. It offers a reference point of resolving conflicts and dilemmas, helping to make decisions that are not only legal but also morally sound. In ethics, you can agree on the same subjects, but you can also have a different understanding. One of the ethics codes we found important was ethics code 1.07 is cultural responsiveness and diversity. And it's important to our debate because cultural responsiveness promotes trust and collaboration between the behavior analyst and the client. It reduces disparities in access to care and upholds ethical standards in the field. As professionals in behavior analysis, we are responsible for recognizing and valuing the diversity within our society and ensuring that our interventions are culturally responsive. The last ethics code would be 2.01, providing effective treatment, and important to this debate because a behavior analyst, a behavior analysis with will always prioritize a client's needs. This code also provides a means for behavior analysts to evaluate, access their own behaviors evaluate and assess their own behaviors. Each code is reflective in each one of these topics. And to now move on, I will pass this on to Miss Laura Ellen to begin her topic and her opinions.
Thank you, Jay. The first topic that we're going to go over is interventions that focus on interdependence and not normative social behavior. Um, so, one of the most effective tools of a behavior analyst is widely used evidence-based practice of functional communication training. We are teaching the individual with communication deficits or challenging behaviors based on communication deficits to communicate in a normative manner. While this may seem like we are placing an individual into a box and not affirming their individual characteristics, we would be doing a disservice to not teach them conventional communication methods. Social validity of treatment options is a key point of Section 2.14 of the Ethics Code for Behavior Analysts. Social validity is the degree to which behavioral interventions are deemed acceptable, efficacious, and meaningful by those they affect, such as clients and their families. In this technological world, I would include the community you interact with online as well. While interventions focus on individuals and not normative social behavior are a disservice and unethical unless vetted properly. The simple fact that unless the individual will live in a bubble their whole life, the individual will encounter a situation where normative social behavior will be expected, and being able to use skills like functional communication training will be more effective than skills that are sensory based. Now, I'm not advocating for the elimination of sensory treatment. Teaching a child to adjust to wearing shoes or self-regulating are important skills. They can also be classified as skills that maintain normative social behavior.
Josh, did you want to touch base on that at all, or otherwise I can dive right in?
Oh, I think Laura Ellen did a fine job summarizing, and if you guys want to respond, and then I can respond to whatever you guys want to say.
Yeah. I like what you said, Laura Ellen, about functional communication skills, but touching base on still allowing them to have those self-advocacy for sensory needed breaks and things like that. I think teaching the learner to ask for those sensory breaks within all settings, even workplaces, instead of forcing them to not engage in stimming because it seems like it's not a normative social behavior. We could take that functional communication and push it towards that, and so that they can ask for these breaks. And so instead of us saying like you can't do this and engage in this for X amount of time, we can teach skills for allowing them to respectfully excuse themselves or to ask for a break and then come back to the task that they're originally engaging in. There is an argument here that certain behaviors shouldn't be engaged in certain areas, like at a funeral, or maybe in certain work environments, but who's to say that needing to change to make you comfortable because it's what society should look like. Understandably, though, it is dependent on each individual, as someone may have more interfering stereotypy than others, but that doesn't mean that they aren't going to implement tasks that make sense for their skill set just because someone is a neurotypical, has a job that is suitable for also for their skill set. Functional communication is great and it's good to teach, but the individualization when it comes to sensory needs and interdependence should also play a huge role, and not just only focusing on FCT.
And I would argue at no point are we saying only to focus on FCT. Absolutely not. Every intervention is going to be valuable on some level. But one thing I wanted to respond to, Katrina, you said, who are we to say that they should change to make society more comfortable, the rest of us more comfortable? I mean, social validity is one of the major points of applied behavior analysis. It's the applied part. We have to find ways to help our consumers exist in the world as it exists. I would love a world where they were allowed to stim to their heart's content and take as many breaks as they need. I don't think we live in that world. We need to be able to teach people skills that allow them to live in the community that exists in reality, and not just a really fun world we all wish we were a part of. Gabby, I think you had a response.
Yeah, I mean, of course, we would love for the world to be just like this super accepting place of everybody and everything. I think that just ties back to like, as Katrina mentioned, teaching them to ask for those breaks and stuff like that. Like, hey, I need the bathroom, and go do what you gotta do. Like, go STEM, like embrace that. And just for maybe it's not acceptable at a work desk and like this kind in those kind of settings, or when you're interacting with a certain customer, stuff like that. But we can still offer ways for them to be able to STEM and to do what they need to do without just putting them into some bubble. And I know like y'all are also already talked about how you're not trying to make them into a bubble. But if we take away a person's personality, or not so much their personality, but like the way they try to communicate, then at the end of the day, we're trying to make them into what society says they have to be. So this comes back to the whole like, let's teach them natural communication skills. Let's teach them what's expected. Yeah. But at the same time, we still want you to be able to communicate that however is best for you in a way. Like we've talked about, sure, like we all know, like with ASC devices, with PEC books and stuff like that should still be acceptable because we're still getting the same message across at the end of the day.
And I absolutely want our clients to be able to communicate in whatever method works best for them. I guess where I see the bubbles coming in is limiting folks to, if someone has to be able to take a break whenever they need to STEM, we've severely limited the number of roles they can fill in society, and that's putting them in a bubble. That's limiting their ability to be a contributing member in a lot of ways. That to me is more limiting than saying everybody needs a baseline set of skills that we need to push everyone toward. I'm not saying that we can't allow folks to have their own personalities, but as a group, I mean, before we started this recording, we talked about certain things we didn't want to bring up, certain things that might not be societally acceptable, and we accept those things. That doesn't tell us we can't have personalities. It's that we know we exist in a group of people that have expectations, and everyone exists in those groups, and I think those groups have to be respected if we want to thrive within them.
One thing I kind of want to piggyback off of you, but also switch a little bit within this subtopic of interdependence and not normative social behaviors, is when it comes to pivotal response training. And this is just using someone's natural interest to promote engagement rather than just scripted role playing. I feel like sometimes when we're doing ABA interventions, we look at like the normative social aspects of like job interviews, and for children, how you should play with certain things, and normal everyday conversations that you have with somebody. And just kind of what I wanted just to touch base on a little bit here is we want them to have that confidence in these attempts for socialization rather than feeling less of themselves, especially since it can be common for someone to be less motivated by being corrected or given direct feedback in those moments when they're already uncomfortable being in them. Sometimes social communication just as a whole can be uncomfortable. An example would be like when children are and their peers are, if we're implementing in skill how to engage with certain toys, do they even play with those toys? Do they even like them? Or is it more valuable for them if we teach them for like a gross motor skill that they do enjoy, then they can value from that communication, rather than just saying, oh, Ring Around the Rosie is a popular game, you need to learn how to do it. But maybe they like to do something entirely different, like hopscotch, and that still teaches them like sharing and appropriate responding, and then developing that skill of flexibility. I just wanted to say, as a whole, it is important to teach someone all of these social contacts and skills, but it just may not be where that individual is at, or where they truly would just want to be as a person.
I agree with you. I think that pivotal response training is a huge skill, and that's a great approach. I will also point out that we need to teach them how to ask for things. we don't start with intraverbals. We don't start with those full sentences and having those conversations. We start with making sure that they can appropriately communicate, appropriately ask for attention, demand for attention, tact things in their environment. We don't start with those intraverbals. And I think that's kind of where it begins, is we can't throw a kid into a playroom and say, okay, let's learn NET style. We might need to start with DTT. That might need to be like teaching them those full sentences, teaching them that sentence structure before we can just be like, hey, have a great time. And I think that's where it comes down to, is making sure that we're acknowledging that yes, I think that eventually learning in the environment is great for people. Hands-on learning is great for people. But I think that we also need to acknowledge that we need a base. You need a base to that pyramid. So.
I can dive us right into the next topic here because it kind of flows into that ethical dilemma of typical appearance, which is our second subtopic. The ethics code that I brought attention for this one is Ethics Code 2.13, which is selecting, designing, and implementing interventions that are evidence-based that follow the behavioral principles and are diverse to each individual and their stakeholders. The topic that I wanted to touch base on is anatomy versus social acceptance, which overall focuses on decreasing harmful behaviors, increasing a person's quality of life, rather than focusing on the typical application of how a person should appear. Typical appearance does look different for everyone. We do not all act or look the same. And yes, there are social norms and hidden rules that we follow within society, but we should focus on decreasing harmful behaviors and increasing someone's quality of life best to their skills, instead of focusing on forcing society to accept them for what they are not. Autonomy is your own self-expression and representing your own values against others' expectations. Some people might never gain approval from others due to the way they socially interact, due to deficits, or because it might feel punishing for them. This includes those like replacement behaviors that we teach, and they may not be able to control internally, but some people with a psychological disorder may need to engage in them externally. This could look like if somebody needs to escape, they use functional communication, or if they are going to engage in like self-injurious behavior, they punch a punching bag or a pillow instead. It is more effective for that person's quality of life, for them specifically, on how to deal with their own inner dilemmas, I should say, rather than how they will look within society and looking typical.
I completely get your point, and I appreciate it. I do think that like society looking at them a lot. I would argue that one of the more important topics under this is employability, because at the end of the day, getting that quality of life, making sure that they can support themselves or that they have a purpose, getting up and going to work every day. I think that's individual autonomy as well, as knowing that you're going someplace that day, I'm going to support myself in some way. Typical parents and individuals with autism can take many forms, and I would. And so I think one of the main goals of ABA therapy, and I'm sure the parents of autistic individuals, is, will their child be able to have a job? Employability is defined as an attribution employers make about the probability that job candidates will make a positive contribution to their organization. It is most directly determined by an employer's perception of factors like interpersonal skills and motivation to work at this job. In one of the studies that I read, they found that job candidates with observable ASD characteristics, aka stimming, and those like sensory behaviors type things, did consistently receive less positive job ratings than job candidates without observable autism characteristics. The most concerning characteristics that employers highlighted are inflexible adherence to schedule and hypersensitivity to sensory stimuli. Even high-functioning individuals with autism can still be atypical with social interactions, including facial expressions, eye contact, gestures, and movement. These differences can lead unfamiliar adults to determine that individuals with autism are odd or awkward, making them less approachable and less likable. The data in a study by Wefley and May suggests that a distaste for atypical social presentation is hindering job seeking rather than a lack of professional qualifications. Studies like these validate the teaching of skills to promote typical appearance in individuals with autism. The skills of fitting in or blending are socially significant as they assist individuals getting jobs and being able to support themselves.
Yeah, for sure. I mean, obviously, we want all our kids to be able to get a job one day and stuff like that. I think whenever we look at society and all the jobs that there are out there, I feel like there is almost a place for everyone. Yeah, we're going to have to work on more things with some individuals compared to other individuals, but there's a place where we can find somewhere for them to work and to be able to support themselves. Yeah, they might need the extra care, and I know that's not ideal, but the goal of ABA is to get them to that place where they can have that interdependence and where we can teach them to be functional by themselves and not depend on their parents.
And that's part of what I think Laura Ellen and I are advocating for is teaching them those independent skills. The difference, the way that I see it between the neurodiversity affirming approach and what Laura Ellen and I are kind of maybe that more old school, everybody needs to learn certain lines to toe, is I, is what independence means necessarily. We've talked many times already in this conversation about the stimming and asking to take breaks and all of those things, and that's wonderful if you are working from home and you have the ability to get away. Katrina, you talked about if you need to use a punching bag to, and that's again that's a great skill to develop if you're in your home. I know very few people that are able to take a punching bag with them to their job. And then, if you have to take a break, if you are a cashier at a Kroger, and it's rush time, there is no break available to you. That's one of many. I mean, most jobs you can't just take a break whenever you feel one might be necessary, and that's where we do need to teach people. I don't want to put somebody and tell them they can't be themselves, but there are certain societal functions that we serve where we have to limit the expression of ourselves necessarily. Each one of us already do it, and I think neurodiversity affirming practices are great for folks that are good at masking, folks that are already good at hiding those aspects of themselves when they need to. They can learn through your way already, but there are folks with much greater needs and different functioning severity levels that are going to need a different level of care and a different level of teaching. And I think that's where Laura Ellen and I are advocating most clearly. And I think that's actually the next topic we wanted to discuss anyway. So I don't know if we want to jump right into that. I know Laura Ellen, you had prepared some stuff. Or if somebody else wants to speak, I will go ahead and mute.
I just have one little small bit I wanted to kind of bounce off of you, Josh. Is you did say, I actually wanted to touch base on the word masking. Um, I think it's very easy for us to say that we mask other people and we can kind of reflect their personality and how someone else does at the job. But I just want to say it's physically exhausting for someone to do that, and it may be a hard skill for someone to learn. And the point we're just trying to say is we just want people to be looked at as a human and not as like a medical disorder, and that we shouldn't focus on fixing people. Yes, we need to help reduce any deficits, increase valuable skills, and that'll help them with their quality of life overall. But I think we're just asking people to be heard and respected for who they are already. That's all.
Talking about your point where you talked about like masking and how we want people to be viewed and stuff, there was an article that I read from the American psychologist, sorry, that talked about like our language that we use when talking about people with disabilities and stuff, and how we should be using more of a first person, just so that we're not putting their disability first. And I feel like that goes also with like whenever we talk about different severity levels of autism and stuff like that. Like we don't want that to be what defines them as a person. We want them to be seen as a person. Like, okay, yeah, you're a person with a disability, but you're not your disability at the end of the day.
And that's 100% valid. I employ person first language whenever I can. I don't ever want to reduce the clientele we're serving. I almost said these people, and that feels real bad. I don't ever want to reduce the clientele we're serving to their disability, to their disorder, to whatever that looks like. They will always be a person with autism or a person with sensory processing disorder. They're never just autism. They're never just Jimmy is autistic. No, Jimmy is a person who has autism. But at the same time, I think that type of language goes for every disorder, disability, sort of diagnosis that we treat anywhere in society. My grandmother had cancer. That doesn't mean grandma is a cancer patient. Grandma is a person that had cancer. We treat cancer. We try to fix cancer. We try to cure cancer. We don't just go, well, she's got cancer and that's just who she is and it'll be okay and we're gonna hope she lives the best life she can with cancer. No, we try to fix it. And that's what I'm advocating we do with persons who are struggling with these autistic tendencies, with the stimming, with the different sensory processing needs, the oversensitivity. We try to fix it, and that's where I think we differ.
If everybody's okay, I think we'll move on to the next topic, which kind of goes along with what we were just talking about. So I think this is a great segue. And it's the topic is, should different functioning and severity levels be viewed differently? When we talk about the introduction of neurodiversity as a term to use for individuals with intellectual disabilities rather than diagnostic terminology, we will restrict the access to insurance and undermine all the work parents and caregivers have been working for years to establish. A parent named Alicia Mesa is a parent of a child with severe autism. And she is quoted as saying, "I am extremely alarmed that neurodiversity advocates have been aiming to erase the reasonable and necessary words from my scientific discourse about autism." To add to this argument, the purpose of the neurodiversity movement seems to want to eliminate the stigma that is associated with autism. The response to this should lie in addressing the stigma, not in eliminating fact-based, accurate descriptors in clinical, medical, and scientific discourse. The movement has also decided that the verbiage of autism diagnosis and describing the disorder is ableist, using terms like deficit, disorder, risk, prevention, and comorbid. Singer and Associates advocate that these words targeted for elimination apply to those individuals who are most severely impacted by autism. These individuals have already been identified as underserved. The state of Indiana recently passed an amendment to the Indiana Medicaid that will limit ABA therapy to individuals in Indiana based on diagnostic criteria. This is huge because it will limit the services that even high functioning individuals receive, and eliminating that verbiage of diagnostic disorder, of diagnostic tools, and just in favor of the neurodiversity term can limit insurance paying for services even more.
I will say, yeah, that is very unfortunate on where they're changing amount of hours that based upon the severity levels. And I do understand changing the verbiage can be very unhelpful and defund a lot of insurance. I think the reasoning for the movement is just to look at everybody equal no matter what. And yes, we should look at others differently based upon their severity levels, but we don't want to also underestimate anyone or give anyone low expectations. One thing I was going to discuss a little bit about kind of what I mentioned on earlier. If we look at neurodiverse people as a whole, we are saying that we expect them to have all the same social expectations, be able to mask themselves or not have burnout as quick, and this can lead to more frustration and decreased support, as we aren't allowing them to prove themselves with expectations that we set forth and not others setting them for them. Kind of a little off base from the insurance part, but
Yeah, just to piggyback on what Katrina said, I think a lot of what we're advocating for is that individuals get treated like individuals and as individuals. So in the concept, we understand that expressing severity levels and stuff is important for insurance purposes. At the end of the day, We want it to be an individual based thing. If we just sit here and we just say, okay, they're all at this severity level, that's putting them into this kind of like almost like a box ish, where we're like labeling them as like, hey, you're just here. And in that instance, we're not allowing them to have opportunities to move forward and to move and to understand that they are capable of doing more than just what society may think or what an insurance company may think. Like, yeah, we might have to say this for insurance purposes, but at the same time, are we belittling the human at the point? Like, are we hurting the person?
Whereas I feel like the belittling and hurting the person side of it comes from, and Katrina, you brought up the idea of low expectations. Isn't lowering the expectation the one who says like, well, we're never going to be able to teach you to not do that. We can't help you overcome this deficit, so we're just going to teach you how to best live with it. Uh, Teach them how to live with it, absolutely the best that they can. But I argue always that like the goal is, and this is going to make me sound like an awful person. The goal is normative behavior, and maybe that looks different for each person, and I can respect that. But never stopping that progress, never getting to a point where we go, well, that's just who Jimmy is. He's gonna do that thing. I I'm a big believer in the infinite potential of every person, and I don't want to cut that off by saying, well, but that's who he is, and we don't want to take that away from him. But could he be better? Does he want to be better? And if he wants to be better, I feel like it's our duty to push him to be the best that he can.
I just want to piggyback off of something you said, Josh, about lowering expectations. The entire concept of shaping an individual's behavior is lowering the expectation until we have established that they can reach that next goal. So we are starting with maybe just a lump of clay, and I would love to see a beautiful mug, but right now I need that skill. I need that therapy to get myself to a cylinder shape. So I think that that is a huge part of making sure that we can establish that these services are coming. And yes, individualized, not everybody's going to make a mug. I completely understand that. Not everybody can make a mug. Maybe some people are aiming at that cylinder, but I would hate to start someone at that cylinder because I can't give them base services. You know what I mean?
One thing I will say, just to kind of piggyback off you a little bit too, Josh, is I believe that probably all of us hold all of our clients to high expectations, and we do push them to the very best as they can fit for their skills. Um, I just think that when it comes to like looking at the different functioning and severity levels, when we view them differently, it allows us to really dive into what each individualized expectation can be and where they're at as a person. Some people will only get to a ball of clay. Unfortunately, they may never build into a bowl or anything bigger. And I think that's just where it's unfortunate that insurance companies are like, well, you're high functioning, you can have 8 hours compared to someone who is lower functioning and they need 30, which doesn't make any sense because it's all individualized treatments. And that's how they all should be looked at. Because not saying that, someone who is lower functioning needs that 30 hours, maybe not more than someone who would just do 8, because their social skills could be such a huge deficit, even though they're higher functioning, and they might need those 30 hours to be able to, have a better quality of life and really push them to that high limits. So,
And Laura Ellen, I really loved the ball of clay analogy. I we could run with that all night. That was fun. I guess the way that I look at it, neurodiversity affirming is going, well, it's fine. You're just a ball of clay, and you will never achieve more than that. And that's okay. And I don't want to ever tell somebody it's not okay to achieve what they can achieve. I also don't ever want to limit somebody and go, well, you're just the person that only gets a ball of clay, and that you'll never do better. And that's a no. We're going to keep working at it. Now maybe they never do get past the ball of clay. I don't stop trying, and I think that's the difference. Neurodiversity affirming to me means, and I want to accept everybody. And like I said, if they don't want to be more than a ball of clay, if they don't want to achieve more than a ball of clay, we never treat without assent or consent anyway. But if they want a drinking vessel, even if they can't make a perfectly sculpted mug, this beautiful whatever, I'm going to do everything in my power to get them to a cylinder at least. And even if they never get to the cylinder, even if they only ever achieve a ball of clay, the goal remains. And that's where I disagree with the neurodiversity affirming approach, because that is affirming like, it's fine, you're just a ball of clay. No big deal. No, it is a big deal, man. If you want more, let's do more.
As you mentioned, like obviously we want our clients to keep doing more. We want our kiddos to succeed in the best way possible, obviously. I think a lot of stuff with ABA and as mentioned before is a lot of it is shaping behavior, right? So yeah, we're gonna celebrate it. Like, yeah, you walked into that bathroom stall, we're gonna celebrate it. Yeah, maybe you didn't sit in the toilet, but you walked into the bathroom, and like obviously for your neurotypical people, it's like that's not a big thing, obviously. But I think it's so important and like something that on our side that we're so for is celebrating the small things. And I think that's what it kind of comes back to. Obviously, we're aiming for the same end goal, but at the same time, we're celebrating all the little in between steps that maybe get overlooked. And I feel like obviously like your analogy is great, like mentioned, but I think at the same time, like we can also celebrate, yeah, you made it into a cylinder. Like that's one step closer. And I think something that me and Katrina are both arguing for is like celebrating all of that and also understanding that my one might look different than your one and like that's okay. Like we're still getting to the same place.
And I
So
guess, go ahead,
oh,
Katrina.
okay, sorry. I was gonna say I think that concludes all of our subtopics. If Shay wants to kind of wrap us up and ask us any Q&A that you might have.
Hi, I'm back. um, yes, I want to say that I enjoyed all of these topics. I feel like I actually remember a lot more this time going through than I did last week. 'Cause I love how y'all did all the comparisons, the ball of clay. I love how Laura Ellen had the insurance, information. I love how Gabby mentioned that Katrina and her like advocating for the little steps, like show the celebration, whether you say you going in a restroom, you step foot, somebody might be scared to never step in there. They never want to, but hey, they did it today. So yes, I love them all. It was one question that I did want to ask and I can't remember, but I do remember that I was pinpointing out how I like that when Laura Ellen mentioned that someone with ASD had the least positive reviews at a job, and it went back into Gabby and Katrina's information about they should be able to work these jobs and not be labeled as, oh, they have a disorder. And I feel like that is why they got a lot of least of the positive reviews, because they're labeled as, oh, they have ASD, so they can't function like a typical normalcy of a person. So they reviewed them in a different aspect. But I really like that information. One of the questions that I did have, I believe it was related to the sensory interdependence when it was mentioned how you believe that a person with ASD, which goes back into them being labeled and having those positive and least positive reviews, how they should be able to work in a social setting with everyone, even if they cannot give eye contact. And me as a person, I agree. I think they should be given the opportunity and a chance to have an everyday skill in life. They can grow up to work. They may be high functioning, low functioning, like we discussed those type of words we kind of want to grow out of to say, but They may have a mild disorder. They may have a higher one that they can't function. It just may be like anyone else. But regardless, they should be given a chance and opportunity to try. Especially if they've been trying all their life to reach a skill and a goal that they've been going to therapy for, they should be given a chance as an adult to use those skills. And I see some people feel like that type of disorder should not be put in a situation, due to them not being able to be fully functioned independently when it comes to the responsibilities of being around their other peers. So I just want to say, like, if they don't get to have these options of working like their typical peers, how do you expect them to grow those important skills and to get to their everyday, livelihood if they're not given that chance and opportunity to celebrate those accomplishments and milestones?
I can field this first if that's okay with everybody. I never want to not celebrate the milestone. If they went into the bathroom and it was the first time they've ever done that, fantastic. You know, my quibble with the neurodiversity affirming movement and that whole idea is we don't want to stop at the bathroom door. We want to keep pushing them and pushing them and pushing them. And like I said, if they don't want to ever get better at it, we never treat without assent or consent. But like, there's always a next step that we can be working toward. That's how they get those opportunities to go out into the community and to live that life and to have those jobs. We put them in a box when we say, well, maybe these jobs aren't for them because they need these special accommodations. Like, let's train them to not need the accommodations and be able to do whatever job is out there. I want a full range. I want a full buffet of options for our people and not just the two or three things that they're limited to because of their disability.
I get what you're saying by like we don't want to put them in a box and think, hey, like because you have this, like you can never do this, but at the same time, in a way, we all have that in some way, shape, or form. For example, my hands shake a lot. You don't want me to be your brain surgeon. Like I know that's kind of like a sillier example, but we all have our own limitations, and obviously with the disability, they have a little bit more um stipulations and stuff when it comes to finding a job, but that doesn't mean there's not something out there for them. Like I feel like for everyone there's something. We all have what keeps us from being different, like in different fields and stuff like that. Like we're all in this field because we're passionate about it and because maybe we're good people or like maybe we're good with kids, just different things like that. I think it's also taking into consideration that we each fit in society in a different way.
The last thing I just kind of wanted to touch base on, Shay, when you were talking about when Laura Ellen brought up the the job interviews and how people with ASD were less likely to be hired. Um, for me, I think it's just more of like a workplace type thing where I think people look at people with a disability and see them as, like I said earlier, like a medical disorder rather than a human. And I think it'd be more beneficial for everybody within that society to be given a chance. Even if it doesn't work out, it'll boost their confidence and hopefully give them that reinforcement to better their social skills or to better whatever set of skills is needed for that job. I think we just need to give people an opportunity to prove or disprove themselves because like we said, it takes them out of that bubble of like, oh, you have a disability, you can't do everything. So that's all.
The only thing I wanted to add for that is the study that I quoted for that employability thing stated that the most effective way for people to have a good review and a good longevity in that is the education of their boss. So I think in my opinion, I think the neurodiversity movement should focus more on training employers to be more accepting of people with ASD, and that's the highest rate of success. Shay, do you want to wrap us up?
Yes, I enjoyed everything. I hope everyone who watches this debate enjoys it. So that concludes our debate over neurodiversity affirming practices, and I want to thank everyone for watching. So have a nice one.